With heavy hearts, today the United States reached a tragic pandemic milestone. The White House reporting 1 million American lives have been lost to COVID-19. President Biden delivering a recorded message this morning announcing new efforts to fight the pandemic.
This pandemic isn't over. Today, we mark a tragic milestone here in the United States. 1 million COVID deaths. 1 million empty chairs around the family dinner table. Each irreplaceable losses. Each leaving behind a family, a community, forever changed because of this pandemic. My heart goes out to all of those who are struggling.
The milestone comes just more than 2 years after the first cases emerged in the United States, and the virus quickly upended daily life for all of us, resulting in this tragic loss of life. More names added every day, including many faces that you see now. Joining us to talk about where this country has been and where the pandemic is headed next, ABC News senior national policy reporter Anne Flaherty, also Dr. Brownstein, Chief Innovation Officer at Boston Children's Hospital, and an ABC News contributor. And let's start with you. We know the real toll here goes far beyond 1 million deaths. The National Academy of Sciences even estimating that 9 million family members are grieving a loved one lost to this virus. What did you find in your reporting about the ripple effect on all of those left behind as we look at each one of these faces?
Well, Kara, I think it's important to even start with the fact that most people think that this 1 million figure is actually an undercount, that there's probably more of a death toll than we've even been able to wrap our arms around. But certainly the two biggest ripple effects, mental health and the economic fallout, and those two are intertwined very closely. The statistic that always sticks with me is that more than 200,000 kids have lost a primary caregiver. That has ripple effects within families. The other parent being left behind to try to pay the rent, these kids needing mental health access, and really a shortage of behavioral scientists. So, so many people are behavioral therapists. So many people in this country are dealing with the fallout from this virus beyond just this 1 million. And I think we need to keep that in mind today.
So, John, our nation's healthcare workers have carried so much of this pandemic on their shoulders. We remember those touching moments early in the pandemic of New Yorkers and people around the world just opening their doors and windows to cheer and clap for healthcare workers. Do you feel like that goodwill is still there? And what kind of toll has all of this death just taken on you and your colleagues?
Kira, I've been thinking about my colleagues working around the clock for over 2 years now. The frontline healthcare workers, doctors, nurses, first responders, so many of them are burnt out. And in fact, so many have left the workforce. And that's a bad cycle because more that leave the workforce, the more that it puts pressure on those that are still left behind. And as Anne said, we're dealing with a mental health crisis, not just among our population, but among our healthcare providers. And the challenge is we keep hitting surge after surge, new variant after variant. And we have a vaccine. And unfortunately, there's been so much misinformation, anti-science, vaccine hesitancy, rumors, and there's a lot of pushback against the medical establishment. So that just makes the job even harder. There's compounding issues of dealing with the virus, but also a movement against the science behind how we control this virus.
Yeah. And Anne, there's this new CDC forecast showing hospitalizations and deaths are again expected to climb over the next 4 weeks. You've reported on this. Is there any appetite for a return to mask mandates, you think? And how should people expect this to impact the summer?
So I have not picked up on any appetite at the federal level to return to mask mandates. The CDC is still recommending that people wear masks when they're traveling on planes and in public transportation. But of course, they have no ability to enforce that at this point. I think the thing that people need to keep in mind is that this virus has proven to be unpredictable time and time again. So if you're traveling abroad this summer, I would be prepared to stay abroad for an extra period of time in case you test negative or in case you test positive. I don't see where the CDC might change that requirement that you have to test negative before you fly back home. And then other than that, I think we might see some mask mandates at the hyper-local level in schools or in a particular community. But I don't think you're going to see those brought back on any kind of national level, at least not yet.
So, John, what does the end of this pandemic even look like? And can we just expect to get booster shots every few months or every year? And do you think that'll be enough?
Yeah, well, that's the question everyone has is what does the future look like? And it's hard to predict. As Anne said, there's been a difficulty in predicting where we're going to be in the next few months, let alone in the next year. Being out of the pandemic phase means we're really at a predictable level of transmission. And with new surges, variants, and challenges to healthcare capacity still, and it's happening right now, we're not there. But at the same time, we have the tools, we have testing, we have treatment, and we have vaccines. And I think likely what we're going to see is with waning immunity, that booster conversation come up into play. That probably will be decided this summer by the FDA, likely seeing a shot in the fall. The biggest question right now is what is the composition of that booster? Is it going to be more targeted to Omicron? Is it going to actually be targeted to multiple variants? A lot of open questions, but I think likely boosters in our future. And if you sort of peg it to what we deal with flu, an annual shot may be in our future. But of course, we're going to be in a much better place in the coming months as we still have better tools to essentially bring transmission down and learn to live with this virus.
Last question, Anne, quickly, the vaccines for kids under 5, where do we stand?
So any day now, I expect that Pfizer will announce the results for that third shot for kids. We're waiting on the FDA to review the Moderna version of this. There are meetings planned in June. My best guess would be by the end of June, you'll see this shot in arms for that under 5 age group.
All right, that's just weeks away. Dr. Brownstein, Anne Flaherty, thank you both so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.